Welcome back, everyone, to another episode of Your Mouth Matters. I am Dr. Rebecca Taylor, your host and the owner of Green City Dental, a holistic biological dental office, and O2Dontics, a practice focused on treating TMJ issues, snoring and sleep apnea, and functional orthodontics. So today on this episode, we are doing another Meet the Practitioner. I'm excited about this one. It's taken us a while to get Lily Corley finally in the studio with us. So Lily, thanks for being here.
Oh, it's my pleasure. I'm so grateful and excited to talk about the work that you're doing and how I'm a part of that. I'm really, really excited to be here. Thank you.
Awesome. Yeah. So Lily and I, many of you may have met Lily in the office, maybe before. We actually have quite the history together. You know, Lily and I have worked together for 4 years before? And
yeah.
Then we took a little break and then now she's back.
You know, COVID happened. Things got, COVID-y. And, but we started in 2017. I think that's when I first started in the office, and I came in, doing myofunctional therapy after we had met the summer before. And
yeah. I think we met we were in Port Townsend and we went to this, we had a mutual friend, and I think I had a little booth there or something talking about sleep apnea and snoring and facial development. And you came to find me and I wasn't there. And then you were searching for me the whole time. And you're like, I must meet her.
Yeah, you did a presentation about one of the appliances, the DNA appliance, and how that treats sleep apnea. And I was intrigued because I had my own dental journey earlier where I had really discovered biological dentistry and had a lot of issues. And I would say TMJ had been a pivotal issue for me in my life. And so it felt really exciting to meet a biological dentist. And I think I was there with my son, and I was doing childcare and first aid, and it was a family-friendly community gathering. And so it was exciting when I met you, and you gave this great presentation, and I was like, great, I want to do more. I want to learn all about it.
And the funny thing, if I'm remembering correctly, is that I wanted to learn more about myofunctional therapy. So I signed up for Joy Moeller's class doing myofunctional therapy. And you also signed up for Joy Moeller's class, the same exact class, but we didn't know that each other signed up. And so I remember being in LA, about to go to this class, and I may have texted you or you texted me or something. We're like, hey, we're going to this class. And you're like, oh my gosh, I'm here now. And we're like, what? We both just ended up in LA at this class, just completely. It was
not planned.
Yeah.
And I think I saw you in the front. I saw this blonde head, and I was like, I wonder who that is. And it's a large class. And, a little bit about me is that my training is as a massage therapist. But before I got into massage therapy, I got into cranial sacral therapy. And really, I became a massage therapist so that I could practice cranial sacral therapy with a license. And I had done a training, a certification in cranial sacral therapy in Santa Fe, New Mexico. And what brought me down there was that when I had been living in Eugene, I started having a lot of clicking and popping in my jaw, and it really freaked me out. It's kind of one of those things where you're thinking why is that sound happening, and what does it mean? And if you've never had it before, I was really young. I was in my early 20s, and I went to an orthodontist. I went to a few. And the orthodontist was like, oh, yeah, you're going to need a $25,000 surgery. And as a young, 20-year-old, that was inconceivable. And I was like, no way. There's got to be something else. So, at that time, I was working as a holistic chef, and I was working at a conference center. And I was preparing food for, 100 people. And one of the people who was there was a massage therapist who was a cranial sacral therapist. And they asked me, they're like, do you want to be the body to, we're going to train these other people who are also massage therapists how to do cranial sacral. I was like, great, sign me up, put me on that table. And so they did. And I fell asleep. I was so relaxed, but my popping and clicking stopped after that. And I was just blown away. I was like, that's a miracle. How did that happen? Like, this guy told me I needed surgery and they fixed me. So I was on a mission after that. I was on a different pathway.
It's funny how like our own experiences like that really help shoot us into the complete different directions. You probably had no idea, being a massage therapist and cranial sacral therapist, that you would end up being in a dental office, I kind of felt like the guy who did my original cranial sacral training, he had worked in a dental office treating TMJ for a long time. And I thought that was the coolest thing, actually. And I really wanted to develop those skill sets for myself. Mm-hmm. Yeah. I mean, I think an integrative approach, I mean, like you said, I think if you only have one tool in your toolbox, then like surgery, then when someone presents to you, you're going to say, you need this thing, right? And a truly integrative model of healthcare is where you have many tools and you may use several of them, or you might try one first and you try that. And if it doesn't work, then okay, well, we have this other thing, right? It's not like this one track mind, right? Like, oh, you need surgery. And I think that's, unfortunately, a lot of our healthcare system is that way. We have all these specialties and everything like that, and really smart people and really amazing procedures. But if the diagnosis is not right, or, my view, is always like, well, let's try less. Less is more. Try less. You can always get to that surgical option if you truly need it. But, like just jumping into that is aggressive to me.
It's you can't go back once you've cut open the body, right?
Exactly. Yes.
So it's sort of like, what a miracle we can do that. I mean, I think the advances in modern medicine are nothing short of miraculous in and of themselves. But are they the solution for every symptom you have? And I think when you are a highly skilled doctor who's gone through this training that is focusing you and honing you like a diamond, the pressures that you go through in medical school and, dental school to become a surgeon, you have to be amazing and good, and you have to not make mistakes. And so it's highly rigorous. And they teach you to be correct and to be right, but what if you're missing out on other things because you're so highly focused on your specialty that you're not able to take a step back and go, is this the best treatment for my patient? Are there other things that we can do first before we jump here? And I think that's the hard thing,
Yeah. Well, anyways, it's been really fun having Lily on board, because I, as most of you know, if you've listened to our podcast, I'm very into really being comprehensive and integrating different modalities. And it's so awesome having Lily in our office physically because we get to have a lot of fun with patients and we work together as a team. And I think that that's so awesome. So Lily and I met at a myofunctional therapy class. So can you just kind of talk about let's talk about what myofunctional therapy is, because I don't think everybody knows. I mean, people think of myofascial therapy, and that's not really the same thing.
They sound similar, but they're not the same. And so myo means muscle, right? So when we talk about myofunctional therapy, we're talking about orofacial myology, which is something that was developed in the field of both speech pathology and orthodontics, right, to address lips, tongue, and breathing. So we're looking at a therapeutic model, right? It's a therapy. And then myofascial work is also about muscles, but it's about fascia. And so different types of body work that you have heard of, like Rolfing and structural integration, and a few others, what they do is they work the whole body through 10 series, and they release all the fascia in your body, and they work in your mouth and they work on your toes, because the fascia is 100% connected. If you took your fascia out of your body, you'd have an exact replica of your body in a web. It's what holds everything together. It's a 3D scaffolding that exists within our body. And so myofunctional therapy is working with muscles of your stomatognathous system, which is your face and your mouth and your airway and your teeth, you know? And so that's a very specific system. And I think really, and this is a big concept, and I don't want to just go on a tangent here, but, you know, we're talking about airway. You know, and myofunctional therapy at its core is to teach you to breathe through your nose and get your tongue posture on the roof of your mouth. I think that's, and I will say lips together. So those are the...
And to get you swallowing correctly.
Swallowing together.
I think the main difference between myofunctional and myofascial, how I think of it, is that myofunction is about proper function. It's about creating proper function, which is breathing through the nose, which is tongue should be in the palate, which is if you swallow, that tongue is making this nice waving motion. It's not thrusting forward. It's going, you know, up and back and making a wave. That's stimulating the cranium and the lymphatic drainage and the cranial rhythm and flow, right? And then and so that is huge because, you know, a lot of kids that we see come in and they don't have any function. Their function is dysfunctional. Yes. They are mouth breathing. Yeah. They've got tonsils and adenoids that are enlarged. They've got they might be snoring. They might have, you know, maybe a thumb sucking habit or something that's preventing that tongue from being up in the palate. Yep. They might have really weak lips then in turn, because a lot of times kids that are mouth breathing, you know, their lips, they don't make a seal. They're really, really weak. And so myofunctional therapy is all about building those muscles so that they can function the right way, retraining, because who in, you know, elementary school or preschool learned where your tongue belongs or how you should swallow or your resting position of your mouth, you know, or that you should breathe through your nose. Like I'm still shocked that we don't teach that in school because it's just so foundational to the way that we grow and we breathe and just our health, you know. It's just very, very basic stuff that in myofunctional therapy, you're teaching people how to do this. And sometimes, you know, depending on where you are on the spectrum and how much you need, you know, you might need a lot of myofunctional therapy or you might need less. And so the great thing about Lily is that she's done training in all of these different things. And the really fun thing is that we've kind of combined them all together. So when you come see Lily, you're not just getting the myofunctional therapy part. You're getting the fascial stuff, the massage, the cranial, all of those things kind of together. And I think we've really built something very unique and very cool.
People are always shocked when they're like, you work inside of a dental office. So when I first came in 2017, we met at this class and we were like, oh my God, like Dr. Taylor's like, I need a myofunctional therapist. And I'm like, I want to come to your office and I want to do cranial sacral therapy and myofunctional therapy in your office. So we're like, okay. And so next week there were patients on my schedule. And I was so like, whoa, I'm working in a dental office. I remember that first week I was like, and there were like 2 or 3 people. I was like, let's just reschedule them for next week. And I was nervous. You know, I hadn't worked in a dental office. It was brand new to me. I worked in chiropractic offices and I worked in chiropractic offices. I worked in spas. I worked in my own private practice and I lived in Port Townsend. So I was commuting from Port Townsend to Edmonds. So I had to go across the Hood Canal Bridge and the ferry. And it was sort of like this exciting, you know, the country mouse is going to the city. And I got to like, you know, come in and I'd come and I'd spend the night, one night in Edmonds and I'd work 2 days. And then I'd go back to my country life and my family and everything. But it was really great because it opened me to a whole new world that was really, I became really passionate about it.
I'd say it opened me to a whole new world too, because, you know, I'm a dentist, right? I didn't go through any of the trainings that you went through and learn about cranial massage and all that. And it really gave me a different perspective on that and how how these different treatments should really be integrated and how dental offices, it's like the perfect, these patients, they need both of us, you know, a lot of them need both of us. You know, most people aren't going to have like a couple cranial sessions and then their jaw issues are going to completely go away, right? Like you need the dentist, you need that orthotic, you need the bite adjusted or whatever.
That's the huge thing, is that it all goes together, right? You can't have a bite without teeth and a jaw or muscles or swallowing or breathing. Actually, you have to breathe too.
Your teeth live in the cranium, right? Yeah. And the cranial bones. And
those you have a skull that
get stuck
that houses everything, and that's all connected to your spine, and nerves are like coordinating all of this, and they have to have function as well. And like, you know, that's the thing about integrative care. It puts all these pieces together. So basically I had a massage therapy room in a dental office, and I can't tell you the number of people who are like, whoa, that's crazy cool, you know? And so that was our first experience working together, you know, and I came in and I got really excited, and we learned about Myobrace, which is a treatment for really, I would say mostly kids, but, you know, has application with retraining myofunctional habits for adults too. And so I learned a lot about that, and I kind of helped implement that in the office. And then
we used I think we went to the Myobrace class together. Yep. And Lily and I, once we got together, because we were just like super jazzed about our new like marriage, we were like, we need to go to all these classes. Yes. So we went to West Virginia and like rented a rental car, drove 2.5 hours from the airport in the freaking middle of nowhere, West Virginia, and took Rockabato's course, who is a physical therapist.
Who works with dentists
and does a lot of TMJ stuff. So we took his training together and went out a few times, I think.
Yeah, we went a few times. And then we did the Myobrace a couple times.
Went out to Myobrace a few times. We did another physical therapist who...
Yep.
Who I didn't like.
Bill Esser. He's local in the Northwest. But, you know, it's like everybody has a different style, and they take different pieces of the puzzle, and they really loved what they love. So it's kind of learning.
Well, it was fun because we got to kind of go to all these different classes with different eyes. Like I have the dental eyes, and Lily's got the more body work, you know, eyes. And then and then kind of come back home and figure out, okay, like, what are we going to do?
How does this change what we're doing?
How does this change what we're doing? Or how are we going to be better? And I would say, you know, we are always learning, and we are always changing our protocols. And I think sometimes I know our team gets a little frustrated.
So they're like, wait, yesterday it was this, and now it's this, but then tomorrow you're going to go back, you know. But
I know, I'm so sorry, everybody. But, you know, but this is how we stay cutting edge. And to be honest, if you don't change your protocols, you are a dinosaur.
You have to adapt.
You have to stay on top of things, and you also have to know, you know, when you come back from a class or something, you have to know, okay, how is this going to change what I do, and how am I going to implement this? Because just because you change it up doesn't mean that every single person you've been doing it wrong on, right? Like, it's just like, it's kind of like, let's add another topping on the sundae, right?
Well, and you know, you got to practice these things, and you got to see what the results are. And then, you know, you get informed through your own clinical experiences, which is really important, you know, and I think that's the exciting thing too. And so that was, you know, our first iteration together. So that was in 2017. And I ended up doing a lot of intraoral massage, a lot of cranial sacral therapy, a lot of myofunctional therapy. And one of our favorite things to do was learning about tongue tie release. And so we went down, and that was one of my favorite trips. So we went down to LA, and we got to shadow Dr. Zaghi in his office, and we watched how they did Dr.
Zaghi is an ENT who's kind of pioneered a lot of the tongue tie releases, myofunctional therapy, integrated those together. He runs the Breathe Institute. So we went to him before he really was the Breathe Institute.
They were just getting started with Lily, who's his one of the founders, and so we went down and we got to shadow them. And you know, this I had a tongue tie. So I think we're both a little different. Like I grew up having a lot of issues with like tubes when I was 4, chronic ear problems. I remember I took a lot of antibiotics as a kid for different ear issues, swimmer's ear, and a lot of cavities as a kid. And guess what? I'm really tongue-tied. I was really tongue-tied, you know, and my face really kind of shows that, you know. I have classical symptoms of what an adult who's had a tongue tie's facial development looks like. And so I had a tongue tie release 6 months earlier, and I had a really bad sinus infection right afterwards, and it didn't heal very well. The first tongue tie release I had was done with a dioid laser with another ENT, Dr. Gahary, who's in Portland. He is also a pioneer of tongue tie release, and he works with a lot of infants and mothers and dyads. And he came into it because his children were tongue tied, and he was like, well, let's fix this, you know. And I had gone to see him. And I will say, before this, one of the things that happened is that my son had a serious tongue tie. He was born in 2007, and I could see this like piece of skin under his tongue, and he had a heart-shaped tongue. And I was like, what is this? And I had a midwife, and she was like, he's fine. He's breastfeeding. He gained weight and everything. But I was always like, what is this? You know? And then fast forward years later, and this is before I met Dr. Taylor, I was in a class with, it was an infant cranial sacral class. And it was with Carol Gray in Portland, who actually works with Dr. Gahary a lot and trains a lot of cranial sacral therapists in infant massage, cranial sacral. And we talked a lot about tongue tie, and she looked at me, she's like, oh yeah, you're tongue tied, you know, because I had classic facial symptoms. And I learned all about tongue tie, and I was kind of like, wow, that's amazing. And then I took another class in reflex integration with a woman named Sonia Story, who is also a great pioneer of neurodevelopmental movements, and she works with mothers and families and kids, teaching them how to help each other. And in that class, there was also in Portland, there was a chiropractor, midwives, occupational therapists, lactation consultants, body workers, and everybody was talking about tongue tie. Again, tongue tie. And I was like, oh my God, I have to get my son's tongue released. And then I met Dr. Taylor, and we learned about myofunctional therapy. And I was like, whoa. So I ended up getting my tongue tie released with Dr. Gahary. It didn't heal properly. We were down visiting Dr. Zaghi, and he looked at my tongue, and he was like, oh, please, I need to release that today. And I was like, okay.
And I was like, can you release mine too? And he was like, well, you're not really tongue-tied. And I'm like, I know, but I just want you to. And he was like, well, but you're not really tongue-tied. And I was like, okay, but I just want to experience what people are experiencing. Because you hear about people that have releases and like, oh, everything feels better. So he was like, all right, well, maybe you're a little tongue-tied. So we ended up, we had to change we missed our flight, or we changed our flight?
Yes, we missed our flight. We both
were like mouthful of gauze, all bloody, like he, in the taxi in LA and rush hour traffic trying to get to our flight. And we show up with like the bloody gauze, like, oh, we missed our flight. And the lady was so not nice.
She was not a nice lady. She did not care. We had a doctor's letter. She finally got us on another, we missed our flight, and she got us on another flight the next morning. Meanwhile, the anesthetic had just worn off.
Yeah, I'm so hungry. So we went to a airport hotel and ordered Indian food takeout and just sat at the bar and
it was so great because eating that food grounded me, and I got a real sense of how. So I always tell people after a tongue tie release, I'm like, make sure you have something very nourishing for your body to help ground you.
Yeah,
afterwards.
The curry was a great dinner. Yes, with maybe a cocktail that was also good.
That helped.
So Lily and I would after we just went to Dr. Zaghi's class, she came back, and then we would do kind of we would do cranially assisted tongue tie release, which was really cool for both of us, because like I'd been doing some tongue ties and she's been doing cranial stuff and it all kind of made sense to us. But then we came back into practice, and what a cranial assisted tongue tie release is that when I'm releasing the tongue, so I'm using a laser or scissors to like release the tongue, Lily's actually at the head of the patient holding their head and feeling the body kind of unwind. And, it seems very woo-woo and like, that doesn't, add up. But if you are a chiropractor or an osteopath, or if you've been to a chiropractor or osteopath, or you've done cranial sacral, it's pretty profound, the movements that you can feel in the head. We actually had a chiropractor in here, and I think we were doing his girlfriend's tongue tie release, and he's like, can I sit there and feel her head while you're doing that? And he was like, whoa, this is crazy. Like, there's so much movement. So, some people can really feel those shifts and changes when we do tongue tie releases. And the cool thing is that Lily would be like, oh man, that really released on the right. And she'd say, oh, it's still a little tight on the left. And so, that would help guide me then to go in and look and say, do I see anything that's restricted? Should I release more? And then the great thing was that afterwards, after we put sutures in and did the surgery, then they got to go sit on Lily's table. Mm-hmm. And a lot of times, because you were talking about the fascia, how it goes all the way down, all through the body, the fascia under the tongue goes all the way down to the toes. And so when we were releasing that fascia under the tongue, people's shoulders will drop or their posture will improve dramatically. And some people even have like emotional releases after a tongue tie. And so having that space in our office to where people could basically go right off the surgery table, go sit in this nice peaceful room with nice music, with the lights dim, that's not a dental chair, and just be able to receive some more cranial or, help their body unwind more. And then if they have, emotional releases, have a safe space for people to be in, because a dental office setting is not really designed for that.
No, it's a busy place with a lot of moving parts. But I think that one of the, those are some of the profound experiences, I think, was around doing a cranial assisted tongue tie release, which almost feels like midwifing the process. Yes. Is that like, it can be really intense for the person in the chair. And even though it's a minor surgical procedure, similar almost to, a cavity, and maybe easier than that process, it can release stuck tensions that somebody's had. So there's been lots of people who cry or shake, or immediately some kind of pain comes up in their jaw. And by being there, and with Dr. Taylor sort of having the grace to sort of say, I'm going to let you do some body work now, she would let us work through that in that moment. So we're not just sending them home to deal on their own with stuff that they're kind of like, what's going on? Like, it's unknown and it can be scary. So, there are a lot of times that by midwifing that process, we're sending somebody home to really in a good place where they can kind of move on to the next, whatever integration needs to happen for them. And then often I was doing basically, I had a few different roles. Like sometimes I'm doing the myofunctional therapy for the person pre and post-op, as well as I'm seeing them for body work afterwards and before as well. And sometimes we're working on patients that were referred to us from other myofunctional therapists, which I love that too, because there's a lot of people in the world. You can't help everybody all the time, but it's great to be part of a team that, we can do our part.
Yeah, definitely.
Yeah.
So anyway, COVID happened, and then Lily ended up, we kind of got really, really busy, and it was really fun. But Lily needed more space, and we needed the space for Vanna, our amazing hygienist. And so we kind of parted ways. And then we've kind of been talking. I mean, Lily and I are really good friends, and we've stayed in touch. Obviously, you've heard our story. So we're close and go way back. But she started to treat babies and wanted to do more with babies and do more cranial sacral. And I had my baby and came back into practice, and I've launched a sub company called O2Dontics, which focuses only on TMJ issues, sleep apnea, snoring, and treating kids with functional orthodontics. So helping avoid the need for braces or grow the face the right way, and not just slap on some braces, when they're teenagers. So that's really been my passion. Along this journey, I found like, hey, this is what I want to really focus on. I didn't really want to be around mercury fillings, and being breastfeeding and being pregnant and all that. I didn't. So anyways, and I'm more passionate about this jaw development stuff anyways. So I launched O2Dontics, and I was like, Lily, because you had some other stuff. You were like working at a kids camp, and that was really fun. But I was like, Lily, you need to come work with me at O2Dontics, because, we're growing, and we actually bought the building across the street. So for patients that don't know, Green City Dental is going to be here. It's staying. Dr. Isabel's here. I will be here. Everyone's here. But we need more space. And so we ended up buying the building across the street. You may see the sign if you drive by. So O2Dontics, Green City Dental, same company, basically, but I'm going to be moving across the street, and O2Dontics, like I said, is going to be more of that specialty type of practice, but that means that I have more space. And so I was really excited. I'm like, Lily, you gotta come check out what I'm doing with O2Dontics. I think you'd be really into it. We kind of needed that space for the hygienist. I'm like, I'm going to have like a whole room that could just be for you, And so she's like, okay.
I know.
Interesting.
I was like,
So she came in and started helping us, build a little bit more of the sleep apnea program. And then I've always wanted to, we have a photona laser, and I've heard about Oralase. And Oralase is I didn't know much about it. There's not a lot of information about it. But I just heard good things about it, right?
Yep,
and I heard like there was some forums and blogs and all that, and they're talking about Oralase, and I'm like, we have the technology. I really need to learn that. And so I did a webinar on Oralase, and immediately I called Lily, and I'm like, you have to watch this webinar. It is freaking amazing and mind-blowing. And I'm telling you, if I didn't have you before, you're going to really want to come work with me at O2Dontics and maybe, actually be a practitioner. And so we were like, well, I don't know if we want to go to this class. Like the timing isn't right and whatever. And I'm like, all right, we're going. So we went out to St. Louis and we took this class, and it was so cool. It really, the Oralase class for me really like everything just made so much sense. And it felt like all of the things that we had learned, it kind of brought them all together. And there was this piece missing that I think Oralase just really kind of filled that space, It just makes so much sense.
Well, it's this incredible tool, right, in our tool bag. And, I was so impressed by what we witnessed when we were at this class and experienced, like my own experience of it was profound. So it's been such an incredible, inspirational journey to learn this tool. I'd first heard about it as, an alternative to a tongue tie release, as it's Oralase and Babylase. And what they're talking about is that the Photona Lightwalker laser has two lasers in it. One is an erbium laser, the other is an ND-YAG laser. And the ND-YAG laser has a wavelength of 1064
nanometers. Yeah,
nanometers. Mm-hmm. And that it gets into the layer of hyaluronic acid that connects the fascia to the muscle tissue. And it's a hot laser, and it's green. I love green. Let me just say that.
Green City Dental.
Green City Dental is very appropriate. And so what it's doing is helping the fascia release without all the effort that, when you do it myofascially, it can hurt. It's like it almost feels like you're tearing tissue. Like when you release fascia, like it has a very specific feeling to it.
Fascia is not necessarily like like it's not elastic.
It gets hard, and so but in its like ideal state, it's viscous, so you can glide. You want that viscosity, and that liquid viscosity also transmit messages, which is sort of, if you look at some of the studies looking at fascia now, it's kind of like, is this an information pathway? Is this fluid pathway transmitting information? And, are our acupuncture meridians, are they connected to this viscosity, and what's the overlay and interplay between fascia and meridians, which is really interesting if you're interested in Eastern medicine. But, so here's this laser that can get in there with minimal, physical effort on the part of the practitioner, and help the fascia soften into this delicious liquid hyaluronic acid, which now the muscle can glide. So are we tongue-tied because our fascia is restricted, or are we tongue-tied because we have type 1 collagen, that doesn't stretch? And maybe it's both. So, after working with people and really doing a lot of myofunctional therapy and doing a lot of intraoral work and a lot of muscular work, some people, great, you do that work, they're ready to go. It's easy. Other people, it's not so easy.
It's slow going.
Yeah. And it can be frustrating.
I think this is actually where, myofunctional therapy is great. I recommend it, like everybody. I recommend myofunctional therapy. But the problem with myofunctional therapy is that for those people that are really restricted or that the function is just not there, you're going to be stuck in doing myofunctional therapy for years. Like some of the treatment plans I see from myofunctional therapists are like years. People are like, oh, I've been working for 9 months. There's just been very little to no improvement. And those patients, they get fatigued. They get burnt out. They're like,
it's expensive.
It's super expensive. And they're also just like, I am so sick of this and I'm not seeing the results.
There's no joy in it anymore.
Yeah.
And, I do believe if we're talking about neuromuscular reeducation and we're talking about, building new pathways in the brain, there's a certain element where play is crucial to these changes that we want to see happen. And when you start to feel bummed and burnt out and your kid doesn't want to do it and is throwing a fit, well, that's no fun.
Yeah, it's not gonna work as well. No. And so that's the great thing about Oralase, right? Yes. Because Oralase is going and it's releasing the fascia layer, and so you see these immediate results, right? You'll, like in our class, there was a guy there that has been doing myofunctional therapy for years. He knows where his tongue goes. He knows how it should be. And he's never been able to suction his tongue up into his palate ever. Like years of practicing, he's never been able to do it. And we did about a 30-minute Oralase session on him and shined the laser under his tongue and did all of the other supporting muscles. And in the chair with the laser, he was able to finally do a suction. And he's like, whoa.
It was miraculous to see it change.
How did that even happen? Yeah. And you're seeing this right in front of your eyes, right? And so I love Oralase because it shows you it's very quick. It releases fascia instantly. And it really helps kind of get people a way head start on their myofunctional journey. Because if you can go into myofunctional therapy and the exercises and all of that already ahead, you're going to be so much more successful.
Yeah. Now, I want to say one thing, though, is that for some people, it is so instantaneous that in one session, a huge shift occurs and you're like, wow, that was amazing. Not everybody responds the same way. So that's just something that, some people, they need more, and that's okay. They need more sessions. And so I've seen, after 4 or 5 sessions, because we've been doing a lot of Oralase in the office now, and it's been so fun, and working on kids and working on babies and working on adults and elderly folks, there's a range of different stories out there and experiences. And so, yes, I just want to, just kind of, the grain of salt here is that, like, it's not instantaneous always for everyone, but improvement usually happens every session. And, some people after like 4 sessions, which is what we're standard of recommendation is to begin with 4 sessions. Some people need 12. and that's something we figure out as we're working.
Well, and that's just healthcare, right? Yeah. I mean, it's never one size fits all.
Never.
Right?
No.
So,
yeah.
So anyways, yeah, the Oralase is really, really an awesome procedure. We've incorporated it into our TMJ treatment that we do here at the office. We've incorporated it into our orthodontic phase. When we have kids come in, a lot of the times we start them off in the foundations phase, which is all about building those healthy habits and establishing that proper function, because that proper function is going to hold whatever we do orthodontically, and you're not going to see the same amount of relapse and all of that. So we always want to make sure that we're starting with function and then do appliance therapy if it's even needed. Sometimes we just get away with doing a myobrace appliance or something that's very, very simple. And then we are also using it for sleep. They really talked a lot about in our Oralase class about how sleep apnea is actually a neurotransmitter issue. It's a neurological thing. It's more neurological than it is maybe
obstructive.
Obstructive, exactly. Even though it's been named obstructive sleep apnea. So the Oralase treatment really helps kind of plug the tongue into the brain, and it helps the neurology, which is really fascinating.
It's so fascinating because, I think what they're talking about is the action of the swallow in particular, in terms of what does that create. That if you're swallowing how many times a day?
2,000 times
2,000 times a day. Well, if you're swallowing properly, your tongue and the back of your tongue, the posterior third of your tongue, is going up into your soft palate and making connection there and pumping. So that's like a real direct connection, directly pumping your maxilla, and your sphenoid right there. And so that has function, and if you don't have that going on, you're not connecting right there. And so one, analogy was we are plugging the tongue into the brain, basically, by getting you to swallow correctly. And that makes a lot of sense to me, and actually after my own Oralase session that we received at the class, I was, after 8 years, 7 years of doing myofunctional therapy and having tongue tie releases and being in appliance therapy, I was like, oh, I'm swallowing different. And actually my tongue is up on the roof of my mouth, and it's easy. It's not hard.
And you've been a myofunctional therapist for how long? Teaching people, practicing this every day.
Yeah. So I'm that was a really big light bulb moment, an aha around, one, the power of Oralase, and then, sort of this idea of maybe it doesn't have to be so hard. Maybe what we're looking for is for it to be easier.
Yes. So I would say for anybody who is considering myofunctional therapy, come see Lily first, because she might recommend some Oralase, which is, again, going to just put you that much farther ahead, and it's going to make your myofunctional therapy treatment probably more effective. If you are in orthodontics, or if you have sleep apnea or jaw issues, our office is so integrated. We've got Lily here, and we work as a team together. We have a lot of tools in our tool basket, and we have a very comprehensive approach where we're really looking at, what is the ideal treatment plan for this specific person. It's not always one size fits all. Sometimes I'll have people just work with Lily first because maybe that'll just be enough for them.
Yeah.
And other times it's nope, you're going to need everything that we do, but we really look at people individually, and we have many tools. And I think that's really what sets us apart from a lot of other dentists that even are treating TMJ, or, I guess claiming to treat TMJ. So yeah, if this resonates with you, if you feel like you want to learn more, then come see us. Come see Lily. Set up a consultation with her. She typically will do 1 hour consultations, or
90 minutes for adults and an hour and 60 minutes for children. And I love working with kids. I love working with babies, and I love working with Dr. Taylor. And what I see too, and I want to just kind of also say one more thing about Oralase is Oralase is great and can be a standalone treatment. It is also it was designed to work in appliance with appliance therapy. And what I'm seeing is the combination is pretty amazing. Our bite is a critical part of our function, and crowded teeth and teeth that don't come together well, it changes not just how we eat, it changes how our spine, how our brain, how our body functions. So I'm just so grateful to be here and working with you. So
yay.
Yeah.
Well, we are so happy to have you back, Lily.
So happy to be here.
All right, everyone. Well, thank you for listening. Please make sure that you leave us a review. We'd love a review on our podcast. We'd also love it if you would follow us on social media. We have Instagram, we have Facebook. We have 2 pages, one for Green City Dental and one for O2Dontics. That's a little bit more specific into TMJ issues, that functional orthodontic stuff we were talking about, and snoring and sleep apnea. So until next time, thank you, Lily, for being here.
You're welcome. Thanks for having me.
Remember, everyone, that your mouth matters.